Dr. Rob Hackett was met with smirks and confused, occasionally derisive, looks when he started turning up to surgeries with his name and profession emblazoned in bold black typeface across his scrub cap. Rob, anesthetist, his forehead announced to colleagues and patients alike. You look a little daft because not everyone is doing it, Drive Hackett said. There were some snide remarks, like can't you remember your name? But 6 months on, Drive Hackett's bid to improve patient safety is gradually gaining support from surgical staff in Australia and internationally. The move, they argue, could reduce the chances of delays and misidentification when clinicians can't recognize or can't remember the names of their colleagues in the operating theatre. Surgeons, anesthetists, nurses, midwives and other clinical specialists are sharing photos of themselves donning the cranial name tags, their identities, printed neatly on cotton hats or scrawled with black permanent marker on paper caps. Alison Brindle, a UK student midwife, gifted Drive Hackett's intervention with the hashtag #TheatreCap Challenge. Surgical staff from Australia, the UK, US, Europe and South America have used the hashtag to share images of their own name caps. There's Beth, nurse, and Caroline, ophthalmologist. There's Alison, student midwife, and Joe, obstetrician. When hospital staff are in full scrubs, their faces are almost completely obscured by their caps and face masks, with their eyes and eyebrows suspended between the two. Clinicians can work with hundreds of different combinations of colleagues between multiple hospitals. The revolving door of partial faces can make recognizing your fellow staff member instantly, in time-critical moments, challenging. In the midst of a medical emergency, precious seconds, even minutes can be lost when clinicians can't remember the names of their colleagues in the operating theatre, the campaign's supporters say. In a critical iteration of the bystander effect, Drive Hackett said there have been delays in performing chest compressions on patients in cardiac arrest because no one in the operating room at the time knew who the clinician had tasked with the job, since they had not referred to anyone by their name. Other theatre staff told Drive Hackett of incidents where medical students had been mistaken for surgery registrars and asked to complete procedures. When you work across 4 or 5 hospitals and with hundreds of people, I'd say 75% of staff I walk past I don't know their name. It's quite awkward, Drive Hackett said. Last Friday I went to a cardiac arrest in a theatre where there were about 20 people in the room. I struggled to even ask to be passed some gloves because the person I was pointing to thought I was pointing to the person behind them. It's so much easier to coordinate when you know everyone's names. It's great for camaraderie and it's great for patients as well. Drive Hackett said women having cesarean sections in particular might benefit from the reassurance of knowing the names and positions of every staff member in the theatre simply by looking at their caps. Operating theatres abide by the World Health Organization's surgical safety checklist, which requires all staff to introduce themselves prior to surgery.